Hello, my name is John Gallagher, and I'd like to show you the Dent-Chew brush. This is a single-use toothbrush that is made from a gelatin formulation. It's made obviously in the shape of a mouthpiece, as you can see. Comes in multiple sizes and flavors. In the larger sizes, it has as many as 800 bristles on the upper and lower bite and across what's called the palate arch. When you insert this in your mouth, you have about a 60 to 90 second period of utility where you just gently chew it and you're able to brush your teeth, your gingival margin, and your tongue. And then after that utility period, it breaks down, dissolves, and you swallow the entire thing. It has four reservoirs, two in the upper and two in the lower bites that actually rupture when you take your first compression on it. In that dentifrice, there's also xylitol, which helps the mouth restore itself in pH back to a point where it precludes the development of acid. On the front of this, there is a port for breathing in the event that the user has congestion. And one of the larger attributes beyond that is that after it's delivered oral hygiene, for whatever that market might be, and we'll discuss those. In addition to that, because it breaks down and the entire thing is swallowed, it's capable to be a delivery system for vitamins, therapeutics, for medications, vaccines that are microencapsulated. So we'll take just a look at some of the attributes, and I'll be back in just a minute. In this perspective view of the Dent-Chew brush, you can see the upper bite channel and the top of the palate arch. Note that the bristles that are attached to the vertical walls of the upper and lower bite channels are designed to meet the respective gingival margins at a 45-degree angle, which conforms to the American Dental Association's guidelines, while those bristles that meet the tooth's bite surface are attached at 90 degrees. This is an inverted view of the Dent-Chew brush that highlights the ports that lead to the two lower reservoirs. These ports are typical in both the upper and lower bites and rupture upon compression, causing the dentifrice to be equally introduced into the two bite channels. This is a perspective view of the Dent-Chew brush, which is highlighted to show the front breathing port that enables the user to breathe comfortably in the event of congestion. In this inverted view, you can see the highlighted bristles on the underside on the roof of the mouth. Remembering that when the utility period of 60 to 90 seconds has elapsed, the product begins to break down similarly to that of red licorice or gummy bears. Years ago, I was an Army medic, and it was that experience that gave me the impetus to design this brush for use by the military. However, there are a multitude of other populations throughout the world where the use of the Dent-Chew brush will have real meaning. The largest group in the United States is at-risk children between the ages of 4 and 19 who live near or below the poverty level and are 3 times more likely to have untreated caries or cavities. In the United States, we have 52 million students in that age range, and 31 million qualify for free or reduced cost meals because of their socioeconomic demographics. Beyond these at-risk children are victims of natural disaster from floods and tornadoes, and in earthquakes like those in Haiti and Japan. Then there are hospital patients, old age homes, prisons, airline passengers, and retail locations like Starbucks. Well, now that you've seen the drawings, you're maybe a little better acquainted with the Dent-Chew brush and some of the markets that we're looking at. We get down to the point where we look at the numbers. Our need right now is to go from the single-shot mold, which we've used to develop and actually manufacture this prototype, into a circumstance where we continue the design process of a piece of equipment that would enable us to do much higher volumes. We need, for our next phase, something on the order of about 30,000 samples. But to do that, we need to complete our design work, and then at that point build a piece of equipment, and then at that point manufacture the 30,000 pieces. They in turn will go to Creighton University, or School of Dentistry, and the University of Maryland's Dental School for testing on efficacy. For that process, for this project, we're looking at a cost of about $300,000, and that's what it is that we're trying to raise. So if you look at this and say, this is a great product for its single-purpose use, it brings oral hygiene to those who need it most, it's made of a food product, and then in addition to that, those who are really in dire circumstances where a delivery system is put in play, that's even a greater enhancement. So if you're in a circumstance where you can support us, we would certainly appreciate it. We've established a low threshold for our donations. and primarily because we don't want to see necessarily a separation, so to speak, between large donors and small donors. We feel that rather than going and sending t-shirts or whatever the case might be to our donors, we would like to see ourselves put that donor's dollar to work twice. Once for our purpose, and secondly for the people who most need it. So for every dollar that we raise, we will actually donate one of these every single year for a period of 5 years for each one of those dollars. In addition to that, anyone who's a donor who would like to have their name listed on our website, we can do that, and then at that point you'll be able to see specifically where your name was attached to a specific group of these toothbrushes to go to a particular group in need. So if you're in a position to help us, we'd certainly appreciate it. We'd also ask that if you feel that this is worthwhile, that you ask others to help us as well. Thank you very much for your time, and hopefully we'll get this where it needs to go. Thank you.